With a constantly changing healthcare environment, a new generation of physicians are stepping forward with their own perspectives on the future of better wellness for patients. Dr. Maria Guadalupe Garnica Albor joins us from UC Davis Health to discuss the challenges and aspirations of today's young physicians. Next on Studio Sacramento.
For over 20 years, Five Star Bank has created thoughtful solutions to help the Capital Region thrive. From economic development and education to public health and safety, issues that are vitally important to Sacramento's prosperity. We're proud to be part of the conversation and hope you'll join in.
This Studio Sacramento episode is supported by UC Davis Health, where doctors, nurses, researchers, and staff share a passion for advancing health. Learn more about their latest medical innovations at health.ucdavis.edu.
Dr. Garnica Albor, what would you be doing today if you hadn't decided to make becoming a physician your path career-wise?
I'd probably be working as a health educator. That's something that I love to do, and I was doing prior to coming to medical school and graduating. So I think that I would be still in some way seeing patients and trying to be, a game of sort of help them be able to be healthier and employ better lifestyle modifications that will help them.
How did you come to choose medicine as a career?
So I grew up I was born in Mexico, and I came to the United States when I was 5. And growing up, my family and I didn't know about primary care. I didn't have a primary care provider growing up, and neither did my family. And I think it was when I was in college that I started realizing the importance of it and how much it affected my family and I growing up because we didn't have it.
Like how?
So for example, when I was growing up and I was young, and I was very much obese as a child, and I never went to a doctor's office, and we're told that, maybe we should start doing some physical activity or these kinds of things to get you healthier. And so I was pre-diabetic
Really? How old?
I was maybe like 15, 16, something like that.
That's so young.
Yeah, and I just didn't have that kind of sort of pediatrician or physician to guide me and say, this is leading you down a not so great path, how can we make changes now? And it wasn't when I became a health educator that I started making those changes for myself, and then started, teaching patients about what I had done and things that worked for me. And I think that experience actually really helped me to be able to connect with others that have struggled with that, because it's huge, right, in our country in terms of these lifestyle things that really impact us. So I think that had I had that growing up, it would have been much better for me. And same thing with my family, things like high blood pressure, that, my dad never really went to the doctor for that, and now he has high blood pressure, and sort of how do we integrate him now into, the medical community so that he can get access.
It's interesting, your career path in becoming a physician after being a health educator. Mm-hmm. What is it that most of us in California don't necessarily understand about populations that don't have access in terms of how their life is different?
Oh, it makes such a big difference. I mean, for example, in my practice, right, I see adults only, and I can tell you right away, there's a significant difference in someone's sort of health outcomes if I'm seeing them regularly versus if I haven't seen. Maybe let's say someone hasn't seen a physician in 20 years. There's so much of preventative medicine that could have happened during that time span that didn't, right? And so now we're playing catch up, or maybe now we're finding things like, diabetes, high blood pressure, things that could have been well managed during those 20 years that now have long-term effects because there wasn't any contact with a healthcare provider.
It sounds like a real tragedy.
Yeah, it's very unfortunate. And
go ahead.
I was just going to say, and again, it's sort of, getting individuals to come in on a yearly basis and understanding that not everyone can do that. And that's where those health disparities sort of come in, right? Sort of what makes it easier for some individuals to be able to access healthcare and not for others. And what's our role in being able to address those disparities? Because as a physician, I see that, and I not only look at someone's high blood pressure and all these other things, I look at what's impacting their well-being. And that's not just their medical condition, right? That's their mental well-being. That's, how things are at home, their employment, where they live. All of that is playing a big role in their overall well-being.
This is really interesting because, I've also heard a counter-argument, typically among people who are always concerned with costs, that medicine is undergoing what some might term as mission creep, where it is that, well, why is medicine concerned about, the home environment and what the community looks like and all that? They just need to treat the patients. How do you react to hearing something like that?
I think that just tells me there's more education that has to happen around, again, sort of the healthcare model, right? And looking at sort of just getting away from looking at someone as their disease and really looking at them as a whole person, right? Because let's say, for example, I have someone that has depression, right? And it's not being treated, it's not being addressed, it's being ignored. If that depression isn't addressed, then it's going to be really difficult to get that patient, that individual, to take their medication on time, because there's other things that are going on that are much more important in their mind. So it's really taking a step back, I think, and not so much doing mission creeping, but more so looking at someone overall, as opposed to, again, just their disease process. Because I can say, okay, look, take your medication for your diabetes, take your medication for your high cholesterol, but let's say that this individual doesn't have access to healthy foods and vegetables. Then is that medication really going to make that big of a difference? Not really, not as much as if they're able to get access to good food, they're able to access parks, right, for getting some exercise in. But again, if their neighborhood isn't safe, or if they don't have transportation, all of those things are going to impact ultimately their health outcomes just as much, if not more, than the medication that I give.
So does that mean then that physicians increasingly have to have a voice in those discussions? Because I'm not sure that for the lay public, we necessarily would make the connections that you're making right now for us, both as a physician and as a health educator. And so where does that mean that your role and your colleagues' role, is it going to have to change?
I think that in general, the medical field is understanding a lot more that looking at holistic care, right, is sort of another way to phrase it, is really important. And even though not every single physician out there has to be involved with, all of these other like health disparities and things, I think it is important to be aware of them and understand how we can address them. For me personally, I definitely am very much interested in that and looking at the kinds of policies and things that affect someone's health. Because again, I can give medications and whatnot, but those medications are only going to go so far. But if someone is undergoing different stressors at home, right, then I have to be thinking about that and thinking about what's my role in addressing that. And yeah, I do think that, in general, we do have a large role to play in that. And again, I don't think it's about sort of being intrusive. I think it's more around really being aware. And
well, what I was thinking is that you're going to have to get out of the medical office a little
yes.
bit more. I wanted to ask you, you chose to go into internal medicine. And primary care are kind of like the Marines of the healthcare system, because you're on the front lines. You could have chosen, to do one of those really high dollar specialties, orthopedics, plastic surgery, all that type of stuff. And you chose internal medicine where, at least from what we hear, caseloads are the highest, pay is the lowest. Why did you make that choice?
Truthfully, because I love it. I think that a big portion of that came from, as I mentioned earlier, I was a health educator prior to going into medical school, and I spent a lot of time in the community, in the Merced area, the Modesto area, which that region in of itself has a huge lack of primary care providers as well. And I think it was a community that taught me about medicine, that taught me about the health disparities, social determinants of health, all these things that...
Stop for just a moment and explain to all of us what those two things mean.
Okay.
Health disparities and social determinants of health.
Yeah, so health disparities are, the way I think about it is, again, if you take two different individuals, right, and compare sort of what's the difference in terms of their overall health and their ability to access health care. And if there's differences between these two individuals, why is that and what's driving those differences? And social determinants of health are things like, how does your socioeconomic status, right, influence your ability to be healthy? This is looking at zip codes even, right? Does living in this area of the city, is that much better for your well-being, your health, than living in this other area of your city? And again, why do those differences exist? And how do we address them? So that's sort of how health disparities and is sort of the umbrella term, and socioeconomic status is one of the key players.
So what is it that makes you so passionate about these issues?
I think because, again, I spent so much time in the community and learned about how much power these have, right? If, again, let's take a simple example. If my patient doesn't have a car, I take that for granted personally, right? Because I'm able to drive, I have a car, thankfully, I can get anywhere. But if my patient doesn't have a car, then, and there's not a good bus route or a good way for them to get to the appointment, they're going to miss it, right? And then that is going to impact their care because I won't be able to meet with them. They'll probably be missing multiple appointments. So those I found are extremely big drivers of health in general. And I think that as a physician, addressing those is something that I'm really interested in because ultimately that will lead to better health outcomes for my patients.
And when you think about the practice environment that you may spend your career in, are you likely to have more impact in a giant integrated healthcare system, like a UC Davis, mm-hmm. or is it out in a community clinic somewhere? Where is it that you believe that you as an individual will make the most difference?
I think it's both. And the reason I say that is because you can make change or you can make impact on an individual level, right, patient by patient, or also sort of at a systems level, like you mentioned. For example, you can make small changes at a federally qualified health center to maybe be able to manage chronic diseases in a way that's more patient-friendly, right? Having more tools for patients. Or you can create programs similar like the one that I was in during medical school called ACE-PC, where in this program is accelerated, it's 3 years, and essentially we're trying to address the lack of primary care providers.
Wait a minute, you got through medical school in 3 years?
I did. That was quite an experience.
Tell us a little bit about this program.
Yeah, so I'd always been interested in UC Davis, and I actually didn't know about the program until I was accepted, and it's called ACE-PC, stands for Accelerated Competency-Based Education in Primary Care. Long name for basically saying that we start medical school a little bit earlier and kind of go straight through for the 3 years, and we graduate a year earlier, start residency, complete it, and then basically be able to practice a year sooner than if we would have gone the traditional track. Now, there's no cutting corners, there's none of that. We'd complete everything as if we were doing it in 4 years. It's just, I almost think of it as hyper-focused.
Wow.
Yeah.
Probably hyper hours too.
A little bit, but it was wonderful. I loved it. I think that what was really interesting to me, and the reason why I chose to do that versus the traditional 4-year program, was because from the get-go, the goal of this program is to make you the best primary care provider you can be. And so when I was doing my rotations in surgery, right, or in dermatology, other specialties, when I would go into those rotations, I would always think about, okay, what do I need to learn from this rotation as a future primary care provider? What's important for me to learn here? As opposed to saying, oh, I'm not going to go into surgery, I probably don't need to know very much. No, right? It's a different mentality.
Well, I want to pick up on that theme though. What's important? As a young physician, when you're with your colleagues at around the same age range, same place in their career, what are you all thinking about as young physicians in terms of how you want your careers to play out? What might be different about that than your predecessors?
I think there's a couple of things. I think, again, when looking at the medical field, we've really begun to think about the patient overall as a person rather than just a disease process and what's affecting them. The other thing too is balance, right, and sort of wellness is a big thing right now. And part of it was because, even 30, 40 years ago, that wasn't a conversation that was brought up a lot, this idea of wellness for physicians.
For physicians, because
right.
physicians typically have long hours, lots of stressors on them, and
right.
all of that. And you're recently married, so
yes.
The question is that, how is it that you think about your own wellness in terms of being there for your patients and your colleagues, but also being there for the other loved ones and important people in your life?
Yeah, and I think that's part of the reason why there's a much bigger emphasis nationally, right, around wellness is because we realize the importance of taking care of ourselves while we learn how to take care of others, right? And if we're taking care of ourselves spiritually, emotionally, mentally, then we'll be more present with our patients, right? We'll be more present at home and be able to have a better balance between a very demanding job, very demanding hours, right? But also feel like it's very fulfilling because you'll be well rested, you'll be present.
I'm curious about that because we read in the newspapers that we're facing a very big physician shortage in California as well as nationally.
Right.
You decided to make the leap into the profession. What do you think is holding so many people back from joining you?
I think it's a couple of things. I think it is a very demanding process as well, just to apply into medical school, to get into medical school. It's very competitive, and I think also in general when thinking about underrepresented minorities in medicine, right? If you don't have good mentorship, if you don't have even financial support, it can be extremely difficult to even start the application process into medicine. So I think that in general, we're starting to reach out to the younger, even middle school, high school students, and really talking to them about different ways that they can navigate the system and be able to be successful and achieve their goal. But I think that outreach has to be a big component of that. And I think truly just inviting sort of the younger to be physicians, right? Inviting them to come and really take a good look at what the medical field is. I think that in general we think of it as, oh my gosh, it's so demanding, it's so relentless in the hours, but it's so fulfilling. And I think that if we just give individuals an opportunity to see that side as well, that's all they'll need.
Has technology made a really big presence in your training, or is it still mostly you in the exam room, interfacing with patients?
It definitely has made a difference. So in general, with the introduction of the electronic medical record, which was a big leap, right, from going paper to electronic, there was initially a lot of concern around physicians always facing the computer while they're in the room with the patient, right, and not having that face-to-face interaction, which of course can be very, as a patient, is very frustrating. So I think that now we're being trained how to use the electronic medical record more efficiently, but also without losing that patient-to-patient interaction. So I think that in general, we're more open to technology and being able to fitted in to our patient visits and our medical practice in a way that will accentuate and will improve the patient and physician interaction as opposed to impeding it.
Did you all receive any training in things like telemedicine and rural medicine, that sort of thing?
Not so much in medical school. I think that that is a big component of where we're headed to next to address, again, the shortage, right, of physicians all across. But I think that we're definitely moving in that direction. Right, there'll be more telemedicine available, and I think there's a big interest, even just amongst my colleagues, to go into that route and sort of learn. Because again, I see our field as out of service, right? And so how do we improve the service to our patients so that we can have better health outcomes? And if that's what we need to do, then that's where we'll go.
You raised an interesting point a few minutes ago, talking about the challenges of going into the medical field related to cost and mentorship and things like that. Just access and information, familiarity. Did you have the benefit of having mentors or coaches along the way that were helpful to you?
I think I found them later in my life. Earlier on, I didn't come from a family of physicians. I'm the first in my family to be a physician, and it's difficult, having had that experience, it's difficult to navigate the educational system and understand, what it takes to be a good applicant for medical school. And hence why I said earlier that, having things like pipeline programs where there's mentorship available for students is really important, because I didn't have that growing up. And I found that later in life, which I'm very grateful for, but it still created a lot of struggle and a lot of suffering that maybe shouldn't have happened in terms of the struggle to learn the educational system during that time.
And if you were designing better ways for the educational system to onboard people, other than just pipeline program, what should we as a state, do you have any ideas as, what are the sorts of things that we should be doing in order to spread the word? Because there's a huge need and a huge opportunity. Yeah. But at the same time, because of that disconnect, financial, understanding wise and everything else, if you could wave a magic wand, what would we do?
Oh, that's a good question. I think that in general, providing more resources really for students in the way of financial support, but also connections, right? Again, that mentorship is really important. So, thinking about ways that we can reach out to rural areas, especially where we find difficulty with getting physicians too, because we struggle with competition from LA and the Bay Area because we're drawn to those areas, right? As opposed to rural Dos Palos, which most people haven't heard about, right? And so how do we get physicians there? Is we grow our own, right? Is how do we get young people from those communities to be interested in the medical field and support them through that process. So I think that going into those areas and providing education, providing financial support, and providing mentorship would go a long way in being able to address the big need for healthcare providers.
Now, are you going to stay with us in this region after you finish residency, or where do you think you might go?
If they'll take me, I love to stay. At least, there's need everywhere, and I think that there's a lot of good work going on in this region, from UC Davis and other healthcare providers to address this need, and address the gaps in healthcare access. And I like to learn about, how do we approach that, but also I'd like to address a big need in the Central Valley. And, again, between the Bay Area and Southern California, that region gets forgotten from Stockton down to Bakersfield. What do you
think that we don't know about it, or we tend to forget about it?
I think, in general, that there's when we talk about, going back to health disparity, socioeconomic status, we have a lot of individuals in that area that are very poor. That and, there was some statistics I think I've heard about in, like, for example, Merced. There's about 2,900 patients for every primary care provider, versus other places like Beverly Hills, where maybe it's a couple hundred patients per primary care provider.
Really?
So when you're looking at that, there's a huge disparity, right? And of course, that's going to affect your ability to call your primary care office and get an appointment because they're probably going to be booked for 6 months. That's a problem, right? And so I think that we forget that, and it's an area that doesn't attract a lot of physicians because, again, it's not as attractive as the Bay Area, Southern California, but it's so fulfilling. If you only just get the chance to go and meet the communities and work with the communities, it's so fulfilling because you can do so much and have such a great impact in those areas. In other rural areas of Northern California, right, that are also forgotten, because when we think about California, we think of the beach. And we think, right, but we don't think about sort of these other rural areas that have a huge need.
Right. And I think we'll leave it there. Thank you so much for joining us today.
Thank you.
And good luck on your journey.
Thank you so much for having me. Appreciate it.
And that's our show. Thanks to our guests, and thanks to you for watching Studio Sacramento. I'm Scott Syphax. See you next time, right here on KVIE.
This Studio Sacramento episode is supported by UC Davis Health, where doctors, nurses, researchers, and staff share a passion for advancing health. Learn more about their latest medical innovations at health.ucdavis.edu.
For over 20 years, Five Star Bank has created thoughtful solutions to help the capital region thrive. From economic development and education to public health and safety, issues that are vitally important to Sacramento's prosperity. We're proud to be part of the conversation and hope you'll join in.
All episodes of Studio Sacramento, along with other KVIE programs, are available to watch online at kvie.org/video.